21. Pain management for terminally ill patients is most effective when analgesics are given. A. Around the clock. B. Only when clearly needed. C. After non-pharmacological methods fails. D. As the patient requests them. The answer is A. Around the clock. 22. The physician orders 20 U of U100 regular insulin. The only syringe on hand is a 1 milliliter tuberculin syringe. How many milliliters should be administered? A. 0.02 milliliters. B. 0.2 milliliters. C. 1 milliliter. D. 2 milliliters. The answer is B. 0.2 milliliters. 23. The urinary catheter is kept securely in the bladder by A. Taping the urinary catheter to the leg. B. Securing catheter and collection bag connections. C. Inflating the balloon of the catheter. D. Anchoring the catheter bag to the bed. The answer is C. Inflating the balloon of the catheter. 24. Order, Compazine 8 mg IM stat. Drug available 0.10 mg/2 ml in vial. How many ml would you give? A. 0.6 milliliters. B. 1.6 milliliters. C. 2.6 milliliters. D. 3.6 milliliters. The answer is B. 1.6 milliliters. 25. A medication was ordered by a physician. The nurse believes the medication dose is incorrect. What should the nurse do next? A. Clarify the order with another physician who is available on the unit. B. Ask the nurse in charge if the order is correct. C. Contact the pharmacy department. D. Call the physician who prescribed the medication. The answer is C. Call the physician who prescribed the medication. 26. The immediate treatment for ventricular fibrillation is A. Precordial blow. B. Defibrillation. C. Bolus of lidocaine. D. Ventricular pacing. The answer is B. Defibrillation. 27. A patient requires tracheal suctioning through the nose. Which of the following nursing action would be incorrect? A. Lubricating the catheter with sterile water. B. Applying suction while withdrawing the catheter from the nose. C. Applying suction for a minimum of 30 seconds. D. Rotating the catheter while withdrawing it. The answer is C. Applying suction for a minimum of 30 seconds. 28. 30 minutes after starting a blood transfusion, a patient develops tachycardia and tachypnea and complains of chills and low back pain. The nurse recognizes these symptoms as characteristic of A. Circulatory overload. B. Mild allergy. C. Febrile response. D. Hemolytic reaction. The answer is D. Hemolytic reaction. 29. To remove soft contact lenses from the eyes of an unconscious patient, the nurse should A. Uses a small suction cup placed on the lenses. B. Pinches the lens off the eye, then slides it off the cornea. C. Lifts the lenses with a dry cotton ball that adheres to the lenses. D. Tenses the lateral canthus while stimulating a blink reflex by the patient. The answer is B. Pinches the lens off the eye, then slides it off the cornea. 30. Order 1,000 milliliters of D5W to run for 12 hours. Using a microdrip set, calculate the drops per minute, gtts/min. A. 20 gtts per minute. B. 45 gtts per minute. C. 60 gtts per minute. D. 83 gtts per minute. The answer is D. 83 gtts per minute. 31. Which of the following tasks requires specialized education and should be performed by the nurse only after the training has been completed? A. Administering a dose of promethazine, Phenergan, via intravenous push, IVP. B. Applying a transdermal fentanyl, Duragesic. C. Instilling tobramycin, Tobrex, ophthalmic solution. D. Beginning an intravenous infusion of cyclophosphamide, Cytoxan. The answer is D. Beginning an intravenous infusion of cyclophosphamide, Cytoxan. 32. The patient is to receive 100 milliliters per hour of D5W through a microdrip. How many drops per minute should the patient receive? A. 25 gtts per minute. B. 30 gtts per minute. C. 100 gtts per minute. D. 200 gtts per minute. The answer is C. 100 gtts per minute. 33. Immediately after a craniotomy for head trauma, the nurse must monitor the drainage on the dressing. Which of the following should be reported? A. Blood tinged. B. Straw colored. C. Clotted. D. Foul smelling. The answer is B. Straw colored. 34. Which of the following interventions should the nurse implement if a patient complains of cramps while irrigating the colostomy? A. Reduce the flow of solution. B. Have the patient sit up in bed. C. Remove the irrigation tube. D. Insert the tube further into the colon. The answer is A. Reduce the flow of solution. 35. A nurse is not familiar with a particular solution ordered to irrigate a patient's wound. The appropriate action would be to A. Check if the solution is available on the ward, and if so, use it to clean the wound. B. Put a neat line through the order and rewrite the solution more commonly used. C. Check with the pharmacist about the uses of the solution ordered. D. Ask the patient what solution he would prefer to be used. The answer is C. Check with the pharmacist about the uses of the solution ordered. 36. A 65-year-old patient is admitted with ischemic stroke. Which of the following would be initially assessed by the nurse to determine the patient's level of consciousness? A. Visual fields. B. Deep tendon reflexes. C. Auditory acuity. D. Verbal response. The answer is D. Verbal response. 37. While preparing for a kidney biopsy, the nurse should position the patient. A. Prone with a sandbag under the abdomen. B. Lateral opposite to biopsy site. C. Supine in bed with knee flexion. D. Lateral flexed knee chest. The answer is A. Prone with a sandbag under the abdomen. 38. To promote accuracy of self-monitoring blood glucose by patients, the nurse should A. Retrain patients periodically. B. Direct patients to rotate testing sites. C. Advise patients to buy new strips routinely. D. Compare results from patient's meter against lab results. 38. To promote accuracy of self-monitoring blood glucose by patients, the nurse should A. Retrain patients periodically. B. Direct patients to rotate testing sites. C. Advise patients to buy new strips routinely. D. Compare results from patient's meter against lab results. The answer is A. Retrain patients periodically. 39. After administration of penicillin, a patient develops respiratory distress and severe bronchospasm. The nurse should A. Contact the physician. B. Apply ice packs to the axilla. C. Assess the patient for orthostatic hypotension. D. Encourage the patient to take slow deep breaths. The answer is A. Contact the physician. 40. The administration of which of the following types of parenteral fluids would result in a lowering of the osmotic pressure and cause the fluid to move into the cells? A. Hypotonic. B. Isotonic. C. Hypertonic. D. Colloid. The answer is A. Hypotonic.